Ever stop to wonder how your kidneys manage waste products in your body? It's an intriguing question, isn't it? Well, today we're going to explore the fascinating process of renal secretion and reabsorption. This process is like a well-choreographed dance that happens in your body every moment of every day. It's a fundamental aspect of human physiology, and it's crucial for maintaining the balance of substances in our bodies. Why is this important, you might ask? Well, understanding this process is not only vital for medical students studying to become the future's healthcare professionals, but also for anyone with a keen interest in how our bodies work. Whether you're a seasoned medical professional or a curious intellect, understanding the mechanisms of renal secretion, reabsorption, and the glomerular filtration rate offers a deeper insight into the human body's complex workings. So, are you ready to join us on this exploration? To understand this, we need to delve into the fascinating world of renal physiology. First, it's essential to understand the basic functions of the kidneys. These bean-shaped organs, located on either side of your spine, are the unsung heroes of your body, tirelessly working to keep your system in balance. So, what exactly do these little powerhouses do? For starters, they filter your blood. Every single day, your kidneys filter about 200 quarts of blood, removing waste and extra water to produce approximately 2 quarts of urine. This filtration process is the first step in the removal of harmful substances from your body. But the kidneys aren't just one-trick ponies, they also perform the equally important task of reabsorption. After filtering the blood, the kidneys reabsorb essential substances like glucose, amino acids, and electrolytes and return them back to the bloodstream. This ensures that your body retains what it needs while getting rid of what it doesn't. Next up, secretion. In addition to filtration and reabsorption, the kidneys secrete ions and other substances directly into the tubules. This process further helps in the elimination of substances that need to be removed from the body, including drugs and metabolites. Finally, the kidneys are responsible for excretion. This is the final step in the cleansing process where the waste substances, now in the form of urine, are transported from the kidneys to the bladder, and eventually expelled from the body. But the kidneys' role goes beyond these functions. They also maintain homeostasis, the body's state of equilibrium. They do this by regulating the body's fluid volume, electrolyte composition, and acid-base balance. This is vital because even slight imbalances can lead to serious health issues. So there you have it. The kidneys aren't just about making urine. They're hard-working, multitasking marvels that filter, reabsorb, secrete, excrete, and maintain homeostasis to keep our bodies running smoothly. The kidneys are vital players in maintaining our body's balance. Now, let's dive into the details of renal secretion and reabsorption. Let's start with renal secretion, a crucial process in waste elimination. As the name implies, renal secretion is the act of the kidneys secreting substances from the blood into the tubular fluid. This is the second step in the formation of urine, following glomerular filtration, and it plays an essential role in the body's waste management system. Now, imagine the renal tubule as a busy highway, with substances like hydrogen ions, potassium ions, and certain drugs as the cars. These substances are secreted from the peritubular capillaries, which act as the on-ramps onto this highway. They then travel along the renal tubule, eventually exiting the body as part of the urine. This journey begins in an area known as the proximal convoluted tubule. Here, the body secretes substances like hydrogen ions, which helps to maintain the body's pH balance, and organic ions, which include metabolites and certain drugs. These substances are actively transported across the tubular epithelium and into the tubular fluid. Next, the substances reach the distal convoluted tubule and the collecting duct. This is where potassium ions, which are important for nerve and muscle cell functioning, are secreted. The secretion of potassium ions is regulated by the hormone aldosterone, which increases the amount of potassium secreted when levels in the body are high. The final stop on this journey is the renal pelvis, where the secreted substances join the urine and are ultimately expelled from the body. This process of renal secretion allows the body to eliminate waste and maintain a stable internal environment known as homeostasis. It's important to note that renal secretion is a selective process, meaning the kidneys choose what to secrete based on the body's needs. This selective secretion helps to ensure that the body retains the substances it needs while excreting those it doesn't. And that, in a nutshell, is the renal secretion process, a key player in waste management. Through this process, our kidneys work like well-oiled machines, constantly filtering and secreting to keep our bodies clean and healthy. Now, onto renal reabsorption, another essential process in waste management. Picture kidneys as diligent managers, busy sorting out what our body needs to keep and what it needs to let go. While renal secretion is all about actively removing waste, renal reabsorption is the opposite. It's the process of reclaiming vital substances from what was initially destined to be waste. Let's delve a little deeper. After the first steps of filtration and secretion, we have a mixture in the renal tubules, commonly known as the tubular fluid. This fluid is full of water, ions, nutrients, and waste products. However, not everything in this fluid should be disposed of. This is where renal reabsorption comes into play. Our body, being the efficient system it is, doesn't want to lose all the useful substances in the tubular fluid, so it reabsorbs them back into the bloodstream. Think of substances like glucose, amino acids, and sodium ions. These are vital for our body's functioning and are therefore reabsorbed. This reabsorption process primarily happens in the proximal convoluted tubule, a part of the nephron in our kidneys. Here's how it works. The cells lining the tubule have a side facing the blood vessels and another facing the tubular fluid. These cells transport the necessary substances from the tubular fluid through their structure and into the blood vessels. This transport is a combination of passive and active mechanisms. For instance, sodium ions are actively transported out of the tubule cells, creating a concentration gradient that drives the passive reabsorption of other substances. It's worth noting that not everything is reabsorbed. Some substances like urea are partially reabsorbed depending on the body's needs. Others, like creatinine, are not reabsorbed at all. And what about the substances that are not reabsorbed? They stay in the tubular fluid, which continues its journey through the nephron, moving closer to becoming urine and eventually being excreted from the body. So, through reabsorption, our body retains what it needs and the rest is destined for excretion. So, we've covered secretion and reabsorption, but what about the glomerular filtration rate? Well, let's dive right in. The glomerular filtration rate, or GFR for short, is the rate at which our kidneys filter blood. Think of it like a speedometer for your kidneys, measuring how quickly they can get the job done. It's measured in milliliters per minute, and typically, a healthy adult has a GFR of about 90 to 120 milliliters per minute. But why is the GFR so important, you ask? Well, it's because it gives us a clear snapshot of how well our kidneys are functioning. If the GFR is high, that means our kidneys are working efficiently, filtering out waste and excess substances from the bloodstream like champs. On the other hand, if the GFR is low, it's a signal that the kidneys aren't doing their job as effectively as they should be. This could be due to a variety of reasons, from dehydration to more serious conditions like chronic kidney disease. The GFR is so crucial that it's often used as a key diagnostic tool in assessing kidney health. In fact, medical professionals use it to stage kidney disease, with a GFR of less than 60 for 3 months or more, indicating chronic kidney disease. However, it's not just about diagnosing disease. The GFR can also guide treatment plans. For instance, if a patient's GFR is low, doctors might recommend changes in diet, medication, or even dialysis in severe cases to help the kidneys do their job better. But don't worry, the GFR isn't something you need to obsess over in your day-to-day life. It's just one of the many tools in our medical toolkit to ensure our kidneys, and by extension our bodies, are functioning at their best. In short, the glomerular filtration rate is a vital component of kidney health, giving us a quick and easy measure of how well our kidneys are doing their job. And as we all know, healthy kidneys are crucial for a healthy body. Remember, a healthy GFR indicates efficient kidneys, vital for our overall well-being. So, let's recap what we've learned about renal secretion, reabsorption, and the glomerular filtration rate. The kidneys are remarkable structures, working tirelessly to maintain our body's homeostasis. They accomplish this through several processes, including renal secretion and reabsorption. Renal secretion involves the active transport of substances from the blood into the urine, helping rid the body of toxins and maintain a balanced internal environment. Renal reabsorption, on the other hand, is the process that allows our bodies to retain vital substances like glucose, amino acids, and water, preventing them from being lost in the urine. One crucial aspect of these processes is the glomerular filtration rate, the measure of how much blood the kidneys filter per minute. This rate is paramount in assessing kidney function and identifying potential kidney diseases. And there you have it. a glimpse into the fascinating workings of your kidneys. Stay curious, keep learning, and until next time, take care of your kidneys.